viewers, and welcome back to the TVS series. And remember, what we do with the TVS series is making sure that we're passing out positive information to be able to at least help us, build a better society. So that's kind of what we're looking to. It varies from health to, name it, anything that we can do to put out the right information to be able to get people on the right path. So again, I'm your host. My name is Ify, and we have a very interesting topic for you guys today. Did you know that cardiovascular disease is about one of the top ranking things that are actually affecting women from African descent? Hmm. I found out recently and I thought, you know what, let's jump right into it and take a deep dive just so we can understand what this is, how it affects us, what we can do, how we can prevent it, what are the measures we can take to be able to keep ourselves away from that path. What better person do we have to discuss this with us today? We have a wonderful guest in the house today. Her name is Ofonime Bliss. I will tell you a little bit about her. So she is an accomplished emergency nurse practitioner turned educator with a passion for teaching cardiology. Her career encompasses direct patient care, freelance instruction in emergency procedures. After years of hands-on experience in the ER, she now empowers fellow healthcare professionals through engaging education. She's a founder of Med Skill Mastery, an online platform designed to bridge the gap between theoretical knowledge and clinical practice by providing accessible, engaging educational resources for healthcare providers. What a portfolio, guys. All right. Ofonima Bliss, you are welcome to the show today. Thanks for joining us.
Thank you so much for having me, Ify. How are you today?
I am doing great and good to see you. You're looking good yourself.
Yes, thank you so much for having me. This is a topic that I am very passionate about. So I was really excited when you reached out to talk about it, and I cannot wait to share this with the audience.
Yes, and we're looking forward to learning from you. So we do hear about cardiovascular disease, all the time, right? So in a layman's term, just for people like me and maybe others who really don't understand what that means, what exactly is this disease?
Okay. So the best way I can break it down is let's look at the words. So cardio, which is you think when people are doing cardio at the gym, they're working out their heart. So cardio is the actual heart itself. Vascular is the vessels. So the heart has vessels, they're kind of like pipes that carry blood to the rest of the body. So that's cardiovascular, heart vessels. And the disease is actually the process where your body's normal function is interrupted for whatever reason. Okay. So in summary, cardiovascular is heart vessel disease that occurs when your vessels either get clogged up, damaged from specific disease processes, exposure to toxins in the environment that can cause you to have this disease. And also there's a genetic component to it.
Oh,
I have a little
that's
heart
a
model.
great way to put it.
I have a little heart model here, right? So you have the
Oh,
heart.
that is so
Yeah.
cute.
You have a heart and then you have the pipe. And when I talk about the pipes, I'm speaking mainly what we call arteries because they pump blood to the rest of the body. So your brain. And it's amazing because the heart also pumps blood back to itself. So when you hear of a heart attack, it means your heart didn't get enough blood because the vessels didn't give it enough blood because
That's
it's
so much
disease.
to learn.
Yeah.
That is so much to learn. Well, thank you for the layman's explanation because trust me, some of us could
I
think
know.
of so many things when we mention cardiovascular disease. All right, so I do know today my focus majorly is for, I would say, women of African descent. And when I say African descent, I'm going to rely on you, probably in a medical
Okay.
term, to kind of define what that means. So, me, what I'm looking for or looking out for is people, in the Black race. Right. So we hear that recently, studies have shown that about 80% of the people in this category, are prone to this disease in their lifetime. And that's a lot. So my question is, how true is that? And if it's true, why?
Um, that's a great point. And the healthcare literature actually does not differentiate African descent. It uses the term Black. And Black accompanies African Americans, Africans from all parts, North, South, East, West, and Afro Caribbean. So while it's not quite easy to tag down 80%, what we do know is that cardiovascular disease is the leading cause of death for Black women, and this was from the American Heart Association, which makes Black women to be exposed to higher risk for having a stroke, which is lack of blood to the brain, having heart failure, where that pump of the heart stops working, mainly because the major risk factor is high blood pressure, which we will get into that, but that is what's called the silent killer, because you don't necessarily have symptoms, but when you start having failure of your organs, such as the heart, the brain, and kidneys, then people then realize, oh my God, I've had high blood pressure this entire time. And the last thing is coronary artery disease, which is you hear as a heart attack, where your heart does not get enough blood. So because it is the number one killer of Black women, we're at higher risk for these complications from having the cardiovascular disease. And an interesting statistic is that nearly 60% of non-Hispanic Black women that are 20 years or older have cardiovascular disease. We used to think this was an old person disease. After age 20, once you come out of your teens and you're Black, you're 60% more likely to have cardiovascular disease.
This is concerning. So does it have to do with our DNA? Does it have to do with, why is this happening? You would think.
You will see now more in, at least in healthcare, we're trying to identify social determinants of health. So from the American's perspective, you have years of systemic racism that has prevented people from having access to healthy foods, having access to safe areas to exercise, the things that you're supposed to do to prevent this disease, eating right, working out. This population doesn't have access to it. Now, when you go back into the African population, there's a lot of poverty in these countries, right? So you're eating what you can eat. There's not really a setup where you can say, oh, eat these amount of fruits and vegetables. Well, when you haven't addressed the food insecurity, how can you address that? Right. So you have the malnutrition, exposure to toxins, right? You have a lot of areas that are by refineries that give out toxic fumes, specific work environments that may be unsafe for this population. And so years of exposure to that. And it wasn't until I believe the 1960s that women were actually started to be included in heart research, because they thought this was a man's disease at first, until we started realizing that the disproportionate effect that it had on women. And then when we broke that even further to Black women, it's just astounding when you look at it comparison wise to other races.
It is. It is. Wow. Okay. So that's a lot to take in. And if you were talking to someone in that category, let's say Black women today, what would you advise them to stop doing and start doing, in order to get out of this path for cardiovascular disease?
The number one thing that I would say to stop doing is smoking, not just smoking with nicotine cigarettes, but also e-cigarettes. You may hear the teens call it vaping, right? Because what this does, remember those pipes I talk about, the vessels? Smoking and vaping will cause swelling and damage to those blood vessels. So now you can't get blood to where you need it to go, to your heart, to your lungs, to your brain, right? And this statistic that I saw was really concerning, because if you smoke, you increase your chance of having a heart attack by 7-fold. Right?
That's a big number.
That's a big number. And I haven't even gotten to the effect that it has on the lungs. And something that's interesting with the lungs is once you damage that lung tissue, it doesn't regenerate. It doesn't come back. It's not like skin. If you get a scrape on your skin, it's going to come back. That's not what's going to happen with lungs. Once it's gone, it's gone. That's why we try to prevent that from even starting to happening. And this is smoking of anything, marijuana, cigarettes, nicotine cigarettes, e-cigarettes, any exposure to
As
these
long as
type
you're
of
inhaling
toxins,
those things, yeah.
you're inhaling it to where it's not supposed to go, and your body sees it as foreign, and it's a slow, continuous damage until your body replaces the good tissue with a bad tissue, and now we have all these problems later on in life. And
That's a big one.
yeah, and I have two things, if you'll permit me, on to start doing. I would advise that people start getting annual checks. right, with your physician. Most people say, I don't go to the doctor, I'm not sick. It's not about that. It's about going to the doctor to get evaluated for this. Remember, I said blood pressure is a silent killer. You don't see it, right? You don't feel it until it's sometimes too late, right? So just having the discussion where you can continue to get tips and tricks on how to navigate this life. I'm a mom of two young active babies, and sometimes I forget to take care of myself, right? But to be sound in mind, body, and spirit is what you really need. And part of that body is going to get it checked. How is this machine working? Is my blood pressure good? Is my heart rate good? Early detection and prevention prevents these late complications. Another thing that is directly related to decreasing your risk for having these complications, and these complications I'm talking about, heart failure, stroke, heart attacks, is exercising, right? So the American Heart Association recommends 150 to 300 minutes per week. Well, let's break that down of moderate intensity, but to the lay person, what does that even mean, right? So if you're doing activity where you can talk but not sing, that's what's considered moderate. If you are doing vigorous, intensive activity and you gotta breathe, that's what we consider vigorous. So you need to get at least 150 minutes of those a week. All right. And so this gives you, ideally, you want to get a minimum of 30 minutes a day, right? 5 times a week. We can all do that, right? Intentionally walking. This
Yeah.
decreases your risk for that. And not only that, some things that people don't really think about is the muscle strength training, the lifting weights. People are like, oh, I don't want you to be muscular. And I know in African cultures, like people are like, I don't want my woman muscular. I need a little fluff. Well, guess what muscle does? Muscle eats up at fat, helps keep you fit, helps support your bones, decreases your risk for high blood pressure and diabetes because it forces you to use extra, muscle needs extra energy. So it forces you to use extra calories. And a good rule of thumb, and this is easier said than done, is however many calories you take in, you want to burn them in exercise. All right. And that's where the journaling and note taking of what you're putting in and being aware is helpful in managing a healthy lifestyle. Because if you constantly have more calories in than you are using, you are going to continuously gain weight. The only way to lose weight is to maintain the
Burn it
same,
out.
just to burn it off, right? And
Oh,
so we know obesity increases your risk for having heart disease. Well, how do you combat obesity? Whatever you put in, you have to work out. And it starts at a really young age. So us as parents of young people, we need to start to get that into your routine. Walk with our kids. Like we go for a walk after every day. My son is like, oh, I got to burn off my dinner. I'm like, yeah, you got to burn off a little bit about your dinner,
I
and
was
just kind
gonna
of getting
say,
that. Yeah, just
yeah,
getting that into your activity. You'll be amazed.
yeah.
We have screen time. We can utilize screen time really well. Put on some Dance Revolution on YouTube and dance with your kids for 30 minutes. Well, guess what? Now you have gotten 30 minutes of vigorous intensity activity because you
With
can't be
them,
singing with
actually.
those,
That's right.
right? Right?
That's
You know,
right. That's
a-
right.
a-
And yeah, go ahead.
no, it's just really important that we start early and make it a part of life and not just like, "Oh, I got to go work out," but something that we get to do to be able to
Hmm.
have your body healthy enough where you can get out there and keep up with your kids and keep up with your friends and, have a good balance is really important
That's
to
right.
prevent
That's right.
cardiovascular
That's
disease
right.
for sure.
And thank you, because you did mention some things I just want to touch on. This is our everyday reality, right? It's okay
Right.
sometimes for us to hear from you medical practitioners saying, hey, do this and do that and do this. But there's the balance between what some people would say, well, this is what it is, right? So by
Hmm.
situation of this is what it is, I want to come to the point where you said some of the things we should start doing is checking our I think you said our vital signs, our
Yeah,
physical.
but
Yeah,
yeah, vital signs, blood pressure, heart
that's right. So
rate.
this is one point that I think it's really huge if you ask me, because a lot of, we say, if you want to call them underdeveloped environments, I don't want to say
Mhm.
third world, but that's kind of what it is.
Right.
We find out that is not an education that is circulating in environments like that, right? So people
Right.
see going to the clinic as only when you're in danger. So it's only
Right.
probably a near-death situation or something that's really, excruciating in pain that I can't take this anymore, then I have to go to the hospital. But what you're saying today is people should take that into, well, I say, make it a routine to get yourself checked, at least for those vitals, and make sure your blood
Right.
pressure is okay, your blood sugar is okay, all of those things that come together to contribute to this cardiovascular disease, right?
Absolutely. Because if you don't remember, I said it's silent. High blood pressure is the number one risk factor for cardiovascular disease, right? You hear it
That's
called
right.
hypertension. I would talk to patients and they're like, well, I have high. You ask them, do you have high blood pressure? And they go, no, I have hypertension. Well, it's the same thing.
What's the difference? Yeah.
It's the
Yeah.
same thing, right? It's just medically, it's the medical diagnosis is hypertension, but what people understand is high blood pressure. Well, what does this mean? It means those vessels, those pipes that I talked about, there's too much
Mhm.
pressure in there, so you're not able to pump blood to where it needs to be.
That's right.
Think of what
Awesome.
happens over time, right? But you don't have symptoms until you start to have damage to the actual organ, such as the heart. That's why you see people coming in with a heart attack, or they end up with kidney failure because they're not able to get blood to the kidneys. Now they end up on dialysis. You don't want to find out you have high blood pressure when you have to end up on dialysis, which is an external kidney to, you know, to essentially get rid of all the toxins that you usually would get rid of in urine,
That's right. That's
right?
right. Awesome. That's part of it because I was trying to hit on the fact that yes, we're hearing today, and thankfully the world is a global village now. Everybody gets, I would say, majority have access to learning some
Right.
of this information either online or watching videos or hearing from people. So let's not take this as a joke. I would say
No.
put intentionality into it. That's kind of what we're learning today. Make sure, make it a yearly activity if you have to. If you have the opportunity to do it twice a year, even better. Um, you
Right.
know, yeah, as much as you
Absolutely.
can get checked. I think kind of what we're hearing today, because we've heard of situations where someone will say, "Oh, we lost this person," and then you ask what happened. You say the person just slumped, right?
Correct.
What
Correct.
led to that? It could have been detected early, if we had those checks in place. I think that's kind of what
All right.
we're learning
Absolutely.
today. Yeah.
I
Awesome. And
like it.
another,
Be intentional. Be
be
intentional.
intentional. Yeah. And another takeaway, I think it's a major takeaway, is the fact that you mentioned about the exercises,
Mhm.
especially trying to put in at least 30 minutes, at least daily. Now, I like
Correct.
the examples you use because a lot of us moms will say, we have all of these things to do. We have the kids, we have this, we have that. But I think you mentioned a good example of even doing it with the children. So you can play musical video, you guys could dance together. It's kind of an activity, which can be seen as family bonding, but then you're
Right.
putting in the exercise. So that's
Absolutely.
another great takeaway today. Thank you so much. I think we've learned a lot
Yeah.
today. Viewers, I think
Yes.
we've been able to deduce what this is and how, at least to prevent it from our own end, just making sure we don't put ourselves in the line for cardiovascular disease like we hear today is affecting a lot of women of African descent. All right, thank you so much. But then before I let you go, though, I
Mhm.
know you are into the educational space right now, trying to pass out this information to help as many people as possible. If we wanted
Right.
to
Right.
reach out to you, what would be the easiest way to get to you? So would that be your social media handles or
Oh,
email?
well,
How can we reach you?
yes. Thank you so much. I am on LinkedIn and on Facebook with Afanimi Blease. So you just have to look for my name. And then on Instagram, I am MedSkill Mastery. And you can also email me at medskillmastery@gmail.com.
Awesome. So, well, viewers, I'll be putting that on the screen for you guys to
Yes.
reach out to her if you do have more questions, if you need more guidance, whatever it is you may need. I would say reach out to her, and her information will be on the screen. Again, thank you so much. Any last words for us today?
Yes, the American Heart Association has an amazing initiative. You may have seen it. We are in March right now, but this happened in February, where you have the red dress campaign to make women aware of their risk for cardiovascular disease. And they have so many tangible resources to help you navigate your different environments to prevent cardiovascular disease. So check that out.
Awesome. There you
All
go. So
right.
everybody go grab a red dress and let's spread the good news.
Absolutely. Thank you so
Help a
much for
friend
having
to
me. I
help
had
someone.
so much fun, and I know
Awesome.
together we will continue to build this better society.
And that's the whole idea. So thank you, viewers, for listening today. And of course, we thank you, our guest today, who has helped us with, great explanation into what this disease is. We thank you so much for your time. We really appreciate you being here with us. And for the rest of the viewers, remember, building a better society starts with you. So do well to take this information, run with it, and share it to as many people. So that way we can plunge towards a better and healthier society. Thanks, everyone, and I'll see you in our next video.